The Daily Two is brought to you by Charlotte Eye, Ear, Nose, and Throat Associates. Welcome to the Daily Two. I'm Laura Polka. It's a childhood condition many parents may not even be familiar with: pediatric neck masses. Joining us now to talk more about this is Dr. Christopher Tebbit with Charlotte Eye, Ear, Nose, and Throat Associates. Thanks for being here.
Thanks for having me.
What are the types of pediatric neck masses?
Pediatric neck masses can be broadly characterized into four main categories. The first are congenital neck masses, which are masses that the child was born with. Then there are inflammatory neck masses, which typically are a consequence of infection, most commonly in a large lymph node or perhaps an abscess in the neck. And then neoplastic lesions, which are growths in the neck that happen after the child is born, and those can be subdivided into benign and then cancerous or malignant.
And how are congenital and inflammatory masses treated?
So the most common congenital neck masses are branchial cleft cysts, which are a remnant cyst that is left from development in the child, and that usually presents kind of on the side of the neck or in the middle of the neck, a thyroglossal duct cyst. And the primary therapy for those is usually surgical excision. Inflammatory neck masses, it depends a little bit on the nature of the mass. Oftentimes when a child gets an upper respiratory infection, they'll have an enlarged lymph node, and oftentimes that can be treated with antibiotics or perhaps steroids. If it becomes an abscess, that usually requires surgical drainage, and the child is usually treated with antibiotics after the drainage.
And how often are these masses cancerous?
Fortunately, the vast majority of neck masses in children are not cancerous. Only about 10% of the time do we find them to be cancerous.
So if a parent does notice something on a child, when is it a good time to go to see an ENT?
I don't know if there's ever a bad time when your child has a neck mass. They're not that common. I think if you do find a neck mass on your child, a good history and physical examination by an ENT specialist is a good idea. That way we can make the proper diagnosis and start the child on the appropriate therapy. Dr.
Tebbit, thank you for joining us. We appreciate it. If you'd like more information about this topic and others, go to goodsenses.com. For the Daily Two, I'm Laura Polka.